You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today our guest is Michelle Bode. Thank you for being here.
Thanks for having me.
And we're talking about skin.
Excellent.
Shortest name of a topic I think I've ever had, skin. But very important topic, skin. If I remember right from some class probably here in the high school, skin is your largest organ?
Correct.
Okay, so we need to take care of it.
Correct.
All right. Talk a little bit about yourself and why you know so much about skin.
I'm a physician assistant.
Okay.
I went to school at the University of Kansas and then at the University of Toledo Medical Center for PA school. During school, I did a long dermatology rotation, which is where I fell in love with skin and the study of skin. I was hired immediately after that in the Department of Dermatology there, where I practiced as a dermatologist, but I also taught med students at that time.
Okay, cool.
And then I headed out this way and got hired at Dermatology Partners, and I've been working there for about 12 years now.
Awesome. You are the expert. Anytime we have a skin question, you're the person we ask. So there are tons of issues related to skin. And I suppose the one that most people think of is skin cancer. Being someone who grew up in the 80s, we all laid out in the sun with not SPF on, but baby oil on. Mm-hmm. Talk about how that's working out for everybody right now.
Well, all types of skin cancer are on the incidence of skin cancer is on the rise, all types of skin cancer. And that we believe is because of the increase in sun exposure that we've had over the past 30 years, not only from the increased use in tanning beds, but some believe the depletion of the ozone layer and the fact that having a tan has become trendy or a fad.
Sure.
We're hoping to change that trend and hopefully make it less popular to have tan lines and that deep bronze color, but we're not always effective in that type of education. So it hasn't worked out well for us is the short answer to that question.
And you said incidences of skin cancers on the rise, and I know I think there are some skin cancers that are not good, and there are some that are a little more easily treatable, or are there good and bad ones?
That is correct. I would never say any type of skin cancer is good. They're all bad. However, there are some that are a little more life-threatening than others.
Okay.
So there are three main types of skin cancer. There's actually many types, but the most three common types of skin cancer would be basal cell carcinoma being the first, squamous cell carcinoma being the second, and then melanoma being the third most common.
Okay.
Melanoma would be, of those three, would be considered the most life-threatening or the most dangerous to your health. And that's the reason it gets the most press or the most media attention, although it is not the most prevalent.
Okay. But it's life-threatening.
Correct. If you catch melanoma right away, when it's not very deep in the skin, it's easily curable. We simply cut it out. However, if it has penetrated deeper into the skin or into the fat layer of the skin, and definitely if it has spread to the lymph nodes or any other organs, it's very difficult to cure and it's life-threatening.
So can all of the types of skin cancer spread? I know when it starts spreading, do they all spread?
No. The basal cell carcinoma, although technically it can spread, it's very, very rare to see that.
Okay.
Usually basal cell carcinomas, which is the most common one, will grow very, very slowly and just stay locally and get larger and larger. Usually it will turn into like an ulcer.
Okay.
Squamous cell carcinoma is a little more aggressive, grows a little faster usually, and can invade locally into the bone.
Okay.
That one can spread, but again, it can spread to the lymph nodes, not as commonly elsewhere in the body, although it can happen.
Okay.
Melanoma is the one that's more likely to do that.
And what are we looking out for? I know it's always moles and irregular shape. What is all What are we looking for?
Right. Well, as I said earlier, melanoma gets the most press. So what you've probably already heard about skin cancer is looking for the A, B, C, D's, E's actually too, of melanoma.
Okay.
A would be asymmetry. So you're looking for brown spots, not necessarily moles, but brown spots that are asymmetrical.
Okay.
B, you're looking for borders that are not well defined. So you've got a mole or a brown spot that looks annular, but then all of a sudden there's kind of color spilling off the side, or the borders are fuzzy looking.
Okay.
C, my favorite one, color. So moles should not be rainbow or purple or black and then blue and then red. The color is actually really significant.
Okay.
Another thing that I look for with melanoma when I'm doing a full skin exam is all of your moles should kind of match. So if you personally have lots of moles and they all look kind of funny, I'm not going to cut them all off. But if they all look kind of funny because they're asymmetrical, but then you have one that looks funny because it's purple, that's the one that's going to be removed. So you have to take the entire body into consideration when you're looking for weird moles.
Okay.
D is diameter, and it doesn't necessarily mean large moles. It means moles that all of a sudden change in diameter.
Oh, okay.
So, I take a picture of your mole today, and then in a year we look at that picture and realize it's grown by several millimeters. That mole's coming off.
Okay.
Elevation is important as well. Lots of moles are elevated, so that doesn't necessitate that I take it off.
Okay.
However, if you have a mole that's only nodular or elevated in one portion, or it used to be flat and then now the border's bumped up for some reason, that's usually indicative that it needs to be removed.
Okay.
But that's simply melanoma.
Right.
And that's not even the most common type of skin cancer.
Right.
So with basal cell, which is the most common type of skin cancer, you're usually looking for shiny or pearly looking bumps that show up in sun exposed areas.
Okay.
So we see lots of little bumps on the nose or the eyelids, in the eyebrows. People think it's acne that doesn't go away, or just a new mole that's flesh colored.
Gotcha.
But those are actually really early basal cell carcinomas.
Okay.
There's other basal cells that are kind of flat and shiny. There's a lot of variants, but that's probably the most common type to look for.
So I'm already starting to lose track, and that's why we call you.
Right.
And I think this happens a lot with a lot of topics on this show. Just because you have a bumpy, asymmetrical mole, do not incite panic.
Correct.
But that's why you reach out to your healthcare provider.
Correct.
And can somebody start with their family physician? Do they go right to the dermatologist? How does that?
I would start with your family physician simply because a lot of family docs are well trained in dermatology and are comfortable with dermatology. So they can tell you, oh, that's completely fine, stop worrying. Or they can say, I don't know. So they'll send you to us. Every doctor is different, so if they're comfortable with making the diagnosis, they will, and if they're not, they'll send you our way. But that's probably the best place to start.
Okay. And then there are screenings. I know you do screenings for us sometimes for the public that fill up really quickly. But there's screenings. Do people kind of mostly come in with, I've got this spot here, or you can do an all-over body check?
My recommendation for the skin cancer screen is to really take advantage of it. You should come in, you should put on a gown, you should take everything off except for your underwear and let me check you from head to toe. And the reason is, I'm happy if you want to come in and just have me check your arm or check a specific spot that's bothering you. But very often patients will come in for one spot that's completely fine, and then we find a cancer elsewhere.
Okay.
And that's because you simply can't look at your back very well.
Right.
You cannot examine your scalp very well, which is where we find lots of squamous cell skin cancers. And you just do not even know that you have a problem going on there. So if it's free and I'm willing to take the time, you might as well just let me look at you from head to toe.
Right. And family physicians can do that too, or dermatologists if they make an appointment?
You just have to request that.
Okay. And it's kind of awkward, like just check out all of my skin, but cancer is awkward too.
It's worth it if we can remove a skin cancer.
Okay. And what happens when you find something? You've mentioned that, depending on what it is, it needs to be removed. That sounds like just snap your fingers and remove it.
If it's if you're in my office and you have something suspicious for melanoma, I will be doing the biopsy that day. So you don't go home and then get to think about it because I want to take care of it that day.
Right.
So with melanoma, because the depth is so important in your prognosis, I usually take a deep biopsy. Sometimes that means cutting the whole thing out and putting some stitches in, or depending on the location and the size, sometimes I take a special blade and I scoop the whole thing out. And we don't have to put stitches in, and then we send that out. And the pathologist will tell me if in fact it is a melanoma and how deep it is. If it's melanoma, again, we decide your treatment course based on the depth and whether it's spread anywhere. Usually the first course of treatment is to go back, cut out the entire scar, and possibly take some lymph nodes to see if the melanoma has spread. Basal cells and squamous cells are a lot easier to treat. If you come in and I suspect that you have one of those lesions, the same procedure is done. I biopsy it that day, and to be honest, the biopsy is very easy. It takes me about 3 minutes. So it's not a long, drawn-out, difficult, anxiety-ridden procedure.
And you can do it in the office?
I do it in the office. I probably do about 10 a day. So it's very common. But with squamous cells and basal cells, if the pathologist indicates that that's the diagnosis, again, we do go back and cut it out, but we don't have to do any lymph node biopsies. The margins don't have to be as large. And we do have a specialized surgery that we do in our office called Mohs surgery. One of my partners would do that, either Dr. Bedox or Dr. Savasco, and it's simple and easy to do that right in our office.
So it takes follow-up, but that's why you're the experts. You can tell what to do from there.
There are other ways of treating, I shouldn't leave this out, there are other ways of treating basal cells and squamous cells depending on the variant and how deep they are and the body location. There are some chemotherapy creams available. So for example, if you have a small basal cell under your eye and you don't cosmetically want that removed due to how it would look afterwards, we can do a trial of a chemotherapy cream. If you have a large basal cell on your back and you don't want a huge incisional scar, sometimes we can do something called an ED&C, or we can do radiation treatment. So there are less common options, but it just kind of depends on where the location is and the person, the age, all sorts of different things.
So ideally, we want to prevent all this.
Correct.
How important, if I get a sunburn now, is that more of an indicator or a risk factor versus getting a sunburn as a young person? And then talk about SPFs and sunscreen. Like, do you have to have 150 SPF, or is 30, 50 okay?
Those are great questions. And again, they're kind of different answers depending on which type of skin cancer you're talking about. So with basal cell and squamous cell, those are both 100% related to cumulative sun exposure. So it matters how much sun exposure and your skin type, but it is very significant the amount of sun exposure you've had over your lifetime. That's why some individuals can get basal cell when they're in their 20s, because they've had, number one, they have the skin type that's prone to it, but number two, they've just had so much sun exposure over that amount of time, which is another reason that tanning beds are so problematic for us at this point. It's a lot of it's because of the basal cells and the squamous cells that we're seeing. So burns are bad, but it's cumulative sun exposure that we're looking at for those particular types of skin cancer. Melanoma, burns at a young age are very significant. So we need to be protecting our children when we allow them to get bad sunburns, or we allow ourselves to get bad sunburns early in life. We're significantly increasing our risk of melanoma. Melanoma, however, has lots of other risk factors as well. So it's not just the sun exposure. Family history is huge, skin type is huge. So you can't extrapolate. It's not the same.
And sunscreen, 150, is it necessary?
No. So my opinion is that the most important thing with sunscreen at this point, or sun protection we should say, because there's hats, there's clothing, there's shade, sunglasses, is consistency and reapplication. For me, I'm really good about, before I even leave the house, everyone gets a full coat of sunblock. And then we get to the pool and I put it all on the kids again after about an hour and a half. and then I forget my own, and then another hour and a half goes by, and then I forget again.
Yeah.
So it's the reapplication. That's where
okay.
I feel people who think they're doing a really good job with their sunblock are lacking. I have a lot of fishermen, a lot of golfers, a lot of patients who say, but I put it on every day. Well, they put it on at 9 o'clock in the morning and they don't reapply until 9 o'clock in the morning the next day.
Yeah.
And that's gone. A lot
Sure.
of people think they have SPF in their moisturizer and their makeup and that's protecting them, but it's not.
Not
By noon,
necessarily.
that's not doing anything for you. So I don't care that it's SPF 150. That's not necessary, and actually it can be really expensive. It's buying the 30, buying the 45, and reapplying every hour and a half.
Okay.
And especially if you're sweating or in the water.
Sure. Yeah.
So
Wears off a lot faster.
those are the things to remember. One other thing I want to mention too is it's a little bit off topic, but a lot of people are looking for natural sunblock, and that's great. I'm a great proponent of using natural products. You just have to be really careful and make sure that they are protective. The most common natural product right now is coconut oil that people are wanting to use.
Okay.
And I've done a lot of research because I've had so many patients ask about it, but coconut oil only has an SPF of 8 when it's used alone. And unfortunately, I've had a lot of patients burn because SPF of 8 is not so good, and the oil itself is making the patient burn.
Gotcha.
So you have to be really careful when looking for natural products. The best thing is a hat and a rash guard.
Clothes and shade.
And shade, if you don't want to use the chemical sunblock.
Okay. All right. Thank you.
Sure.
All right. We're going to take a break and we'll be right back. Talking with Michelle Bode about skin health, and we were talking a lot about skin cancer and sun exposure and preventative stuff. Two quick things. Hopefully, yeah, because we have other topics to talk about. Is there a healthy amount of sun exposure? Because I've also done things about vitamin D deficiencies and seasonal affective disorder. So is there a healthy amount of sun that we can have? Is there times of day maybe, I
Sure.
think, that are
My
avoidable?
answer is yes. I mean, I'm out in the sun often. I have 2 little kids who enjoy swimming. I enjoy running. I would never tell a patient to avoid the sun 100% of the
Right.
time. That just negatively affects your quality of life.
Right.
So even my patients who have a history of skin cancer, I tell them you just have to be smart about your sun exposure.
Okay.
So if you're an avid gardener, do that in the morning or do that in the evening, not in the
Okay.
middle of the day. If you have to be out in the middle of the day, hat, gloves, rash or sun protective clothing.
Okay.
But again, tanning beds, never a healthy
an
amount
option.
of sun. Vitamin D, a little, you can get a little bit of that through sun exposure, but you can also get that through diet as well.
Yes,
And I 100% understand seasonal affective disorder, but again, healthy amount of sun is a small, smart amount of sun exposure.
So morning, late
Correct.
evening, or
Yep,
evening
stay out
time.
of the sun if you can between the hours of 10 and 2,
Okay.
or protect yourself accordingly.
Dude it up.
Right.
And SPF, we were talking about the SPF number, but there's sprays and there's creams and all kinds of stuff. Is there a difference in that, in the effectiveness?
Yes, depending on how well you are at applying your sunblock.
Okay.
Meaning, the spray is very easy to apply. You chase your kids down and you spray them as they're running away.
You've seen me.
Yes. No, but that's how most children are. However, and the sprays can be very effective. You just have to take into account that you really need to put a thick layer of spray on in order to get the effectiveness that the spray claims to have.
Okay.
So if you really want an SPF of 30, you really have to put a thick layer of spray on and rub it in before they jump in the pool.
Okay.
And that is why a lot of people feel that the sprays are not as effective because we
Yeah.
aren't putting them on correctly.
Right. I also think there's not as much in there.
Correct. It's more expensive.
It's a convenience
because really
thing,
it is.
really.
It's a convenience thing. The creams are easier to apply correctly. So when I apply sunblock at home to my children and to myself, I usually use a cream or a lotion. And then when I'm at the pool, for convenience sake, I'll use the spray. I also like the sunblock sticks for the face.
Oh, yeah.
So we always have, I keep them in my purse, I keep them in my beach bag, and it's just very easy to do my own face and the kids' face with the stick. Those are really effective and usually quite natural. A lot of them are mineral based.
Okay.
So as long as you're following the instructions and using them appropriately, they're all fine.
Reapplying consistently. Okay.
And using the right amount.
Okay. All right. Thank you.
You're welcome.
So there's a whole lot of other things for your skin, that can go wrong. And I'm just going to rattle down the list. Rosacea.
Okay. So rosacea is actually a good topic to discuss when we're talking about sun exposure and skin cancer.
Okay.
Rosacea is much more prevalent in the summer because the biggest or the number one trigger for rosacea is sun.
Oh, okay.
So we always, my office usually fills up around May, June with all of my rosacea patients that are complaining that they're having a flare. Rosacea is often called acne rosacea, and it's not acne at all.
Okay.
It's completely different.
Okay.
It does have a component to it where it looks like red bumps on the face,
Yep.
but it's not acne.
Okay.
There aren't blackheads and whiteheads
Right.
involved. It's usually just red bumps and little pustules or
Okay.
bumps filled with pus.
Okay.
It has nothing to do with childhood acne either. So if you had acne as a child, that does not mean you'll get rosacea.
Okay.
We have no idea what causes it. Nothing, no idea at all. We do know how to treat it, but I can't tell you for sure why.
Eat this kind of diet.
Well, I can tell you that
Okay.
because there are things in your diet that will trigger your rosacea
Okay,
if
okay.
you have it.
Okay.
But we don't know why certain
it
individuals will
starts.
have
Okay.
it. So you did mention diet,
Yeah.
and that is definitely in the top 5 things that will trigger your rosacea are certain types of foods.
Okay.
So if you notice that you get red bumps or a red flushing rash after you have avocados or yogurt or tomatoes or beer or wine, there's a long list of foods that I can provide you with if
Okay.
you want that can trigger rosacea.
Okay.
But most patients, when they read the list, start to panic and say, "These
never
are my
be-"
favorite things,"
Yeah.
but chocolate is on there. So the good news is that usually you only have a few triggers. So you just have to find the ones on that list that will affect you.
Okay.
Now, treating rosacea, avoiding the triggers is the best way. It's the most natural way. It's the easiest way. Well, not always the easiest, but it is the most natural way to treat it. There are several creams out there that are available to use to prevent flares or to treat flares, however you decide you want to use them. And then we also use minocycline occasionally to treat severe flares of rosacea.
And that's a prescription medication?
That is a prescription antibiotic.
Okay.
Rosacea is not infectious, it's not contagious, it's not caused by a bacteria, but for some reason that
works.
particular antibiotic will work for rosacea. It's probably its anti-inflammatory component.
Oh, okay.
But that's rosacea in a nutshell.
Rosacea in a nutshell. Now, you mentioned acne. That's one of the things further down on the list. We can talk about it. Teenage, childhood acne, adult acne.
So
What a lovely topic.
sure. It's, childhood acne, we're actually seeing younger and younger. I used to see children probably around the ages 12 to 14.
Like middle school.
And that was about 15 years ago. Now we're starting to see 9, 10, 11-year-olds that are starting to get acne, and I think that's because puberty is starting younger as well.
Okay.
But usually childhood acne starts out with just kind of blackheads and whiteheads.
Right.
And then it will progress to more of the red, what we call papules, when those blackheads and whiteheads become inflamed.
Okay.
The early stage of acne, usually you can treat with over-the-counter medicine.
Okay.
Benzoyl peroxide products or salicylic acid products. Proactive, although it's expensive, is actually a great combination of benzoyl peroxide and salicylic acid.
Okay.
People ask me about Proactive all the time. Once that acne, if it does, progresses, where you're starting to get cysts and really inflammatory lesions that are leaving behind scars, that's when it's time to go and see either your family doctor, or if he or she's uncomfortable with managing acne, they'll send you on to us.
Okay.
And that's when we start that's when we start to use prescription medications that are a little more difficult to manage.
Okay. So I remember bouts with acne, you always feel like you just want to like take rubbing alcohol and just dry your skin out. And I remember, it might have been somebody in your office, I don't remember, but like, oh Lord, no.
Yes, that is correct.
Bad idea.
Do not do that. And the reason is
because you feel like it's because of oil.
right. You feel like, oh, I'm just going to dry this out.
Yeah.
But what happens is your skin recognizes that and then will overproduce oil. So if you dry your skin out at night before you go to bed, you're going to wake up with an oil slick face because your body is responding to that dry skin.
Ooh, we're too dry. Let's make oil.
Right.
Okay.
So the key is if you're using a salicylic acid at night to treat your acne is to find a good moisturizer that's non-acne causing.
Okay.
Put that on over the top so your face senses, okay, this is nice and calm. This is how it's supposed to be, and you're not going to overproduce oil.
Because it seems a little awkward that my face is oily, but I want to put moisture on
Correct.
it. But you do.
Correct. It seems counterproductive.
Yeah.
But if you're doing a treatment that's going to be drying, you want to put a moisturizer over the top of it so
Okay.
that you don't overproduce the oil.
Okay, so some of it early on is kind of manageable with the right over-the-counter stuff.
Oh, definitely.
Okay.
The other thing I want to mention, because it's always been controversial and the pendulum swings almost every 10 years, diet and acne.
Oh, yeah.
So
chocolate.
when I was in school,
Fast food.
there used to be something called the Acne Diet, and a lot of dermatologists would hand you a piece of paper and say, you cannot eat any of these things, and it was a long list. Everything that you
That's
might
good.
enjoy as a teenager was on that list, and you could not eat it. And then probably about 10 years ago, they decided food does not affect your acne at all.
Okay.
You can eat whatever you want, from greasy French fries to pop and milk and everything, and not even worry about
Okay.
it. So that's what I used to tell my patients. And then as we actually did evidence-based medicine and really started studying it, we realized your diet does make a difference in your acne. It's not specific foods that cause problems. It's actually how healthy your diet is. So if you eat foods that are extremely sugary or will cause your sugar levels to spike, your acne is going to get worse. So pop does make your acne worse. It's not because it's pop. It's
Pop is
because
not the
it's
cause, it's just because
it's so much sugar.
It's sugary.
Yeah.
Okay.
Cake, candy, those types of things, they'll make your acne worse.
Oh.
So those are the types of things to consider, and it's probably true with most health conditions. Have a healthy diet, and that condition will get better. One other thing I should mention, though, there's a small subset of individuals who do have a true milk allergy, and their allergy shows up as acne. So I do have a couple patients that when they've come in and their acne is really cystic and really problematic, and I ask them how much milk they drink, and it's usually men. They'll say, oh, I drink almost a gallon a day. As soon as they stopped drinking that, their acne went away. So you do have to keep that in mind. If you yourself drink a lot of milk, or you have a child that drinks a lot of milk and their acne has suddenly gotten out of control, you may want to consider just cutting back on the milk products to see if that will improve it, and then you've saved yourself a lot of money.
Wow.
Both in the milk and in the acne treatment.
Yeah, exactly. Exactly. So we have just a few minutes left, and we still have a number of things on here. So dermatitis, psoriasis, eczema. Those are the pick.
Okay. So as we're heading into dermatitis, first of all, is a very general term. It just means inflammation of the skin.
Oh, okay.
So technically, a lot of these things will fall into that category. So we'll shove that aside.
Okay.
But eczema or atopic dermatitis is actually an excellent topic for right now.
Yeah.
That usually flares in the fall and the winter because we don't have humid weather anymore, and
Right.
our skin loses a lot of moisture. So everybody, even those of us who don't particularly have sensitive skin or have eczema, need to start getting into a regimen where after we shower, we use a really good moisturizer. A good moisturizer can mean different things to different people.
Sure.
Definitely in our office, we promote the most plain moisturizer you can find.
Yes,
and
we
that's
do.
because we see people that have sensitive skin.
Right.
So
All the scented.
Bath and Body
stuff.
Works is awesome. It smells so good, but most of our patients can't tolerate it
Okay.
simply because of all the fragrance and the different colors. Most of our patients are too sensitive for
Okay.
those products. And I usually don't drop name brands, but in this particular instance, I love Aveeno products. Cetaphil products are fantastic, and CeraVe. Those are the top
Okay.
3 moisturizers that I usually recommend for my skin sensitive patients. I also recommend those for my patients who are in acne treatments as well.
Okay.
So those, those will not cause.
I have a testimony for Cetaphil. It works for our
Yeah,
family.
yeah.
Thanks
and we
to
use,
Dr. Bode.
Yeah, we use that too.
Yeah.
So other things to remember with eczema, and when I refer to eczema, I mean people who just have really, not necessarily kids that have atopic dermatitis, which is a separate diagnosis,
Okay.
but I'm referring to individuals that just get really dry, itchy skin in the
Okay.
winter. You do need to take note of how often you're showering or bathing, and how often or how long you are in the bath or the shower. We have natural oils that our body makes,
Right.
and they're good for us. That's what moisturizes our skin. So if you have a student, or you yourself are an athlete that's in all sorts of different sports and
Yeah.
activities, and you're showering 3 or 4 times a day, you're washing off all of that natural oil.
Okay.
And so you do need to replace that with a moisturizer, or you're going to feel itchy all the time.
Okay. And sometimes, is it okay just to, if you need more than one shower day, is it okay just to rinse and not like always
Yes.
be with soap, like scrubby?
You bring up another good point. Your cleanser is extremely important too. I know there are lots of cleansers out there, especially now, men's cleansers have gotten really popular with fancy scents, and we have seen so many individuals with sensitivities to, Axe body wash or other things like that smell fantastic but are really bothersome to people who have sensitive skin. So you want to use that a lot less often. Use a really mild cleanser like CeraVe or Cetaphil. And again, you don't have to be scrubbing and rubbing cleansing so harshly every single time you're in the shower. It's definitely fine to just rinse off, get the sweat gone,
Right.
come out, moisturize, and be done.
Be done. All right. A lot to think about. Thank you very
Definitely,
much.
as we head into winter. You're welcome.
All right, we're going to take another break and we'll be right back. And we're back. I want to thank Michelle for being our guest today, learning about skin health. It's our largest organ. It protects our whole body. We really need to take care of it. Some of the recommendations that she talked about, no matter what the ailment of the skin is, a lot of it has to do with just protecting it, being gentle with it, protecting it from the sun, and even your diet from the inside out can affect the health of your skin, and just taking care of it and being aware of it, kind of keeping track of things, paying attention to things. And as I mentioned at the beginning of the show, always having a discussion with your healthcare provider if something else is needed. And if you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Carla Pelz at the high school, cpelz@pccsd-k12.net. So think about all the stuff you learned today, all the preventive stuff, all the things for yourself or that you might want to share with other people. And until we meet again, I encourage you to make time for health.